Well, hello. Good morning. My name is, or afternoon, excuse me. Thank you for sticking around this late. Very large crowd. I'm Robert Ross. I'm a research fellow at Pennington Biomedical in Baton Rouge, Louisiana. I'm going to be speaking today on bariatric surgery and the alteration of mitochondrial function within the gut mucosa. We have no disclosures for this presentation. So about 1 in 3 Americans is currently suffering with obesity in the suffering with obesity, and despite decades of innovation in lifestyle and pharmaceutical treatment, metabolic and bariatric surgery remains the front runner in efficacy and durability of weight loss. Our lab specifically focuses on understanding the mechanisms underlying metabolic improvement after metabolic surgery. So mitochondrial respiration has been previously shown to be defective in muscle, liver, and adipose tissue in patients with obesity, and metabolic and bariatric surgery has been shown to improve respiration in these tissues. So the aims of our study were to explore the relationship between bariatric surgery and mitochondrial respiration within the small bowel. So ileal interposition, which is what we currently do in our lab, offers a simplified model of metabolic and bariatric surgery in which a 2-centimeter section of the distal ileum is excised with preservation of the neurovascular pedicle, and that is interposed into a section of the more proximal small bowel about 5 millimeters from the ligament of Treitz. This results in a preserved single lumen undivided unidirectional GI tract where a portion of the distal ileum is able to sample the nutrients that would usually be seen first by the more proximal jejunum. So in our study, we had 25 male C57 mice that were randomized into groups of ileal interposition, a sham surgery where we just cut and reanastomosed, and then control animals. After a 4-week recovery period, we harvested the small bowel and submitted mucosal scraping samples for mitochondrial respiration studies. First, we looked at fatty acid oxidation. There was no significant difference between groups in the duodenum and jejunum. There was a slight decrease in the ileum of the interposition animals compared to our control animals. Further looked at oxidative phosphorylation, which is the highest energy producing step of mitochondrial respiration, and we again didn't see a significant difference in the mitochondrial function between these different groups with the duodenum, the jejunum, or the ileum. So finally, we looked at citrate synthase activity, which has been validated as a biomarker of mitochondrial density. And what we found was that there was a significantly decreased density of mitochondria in the duodenum and jejunum of the ileal interposition animals. So overall, the ileal interposition in mice caused both an upstream and downstream decrease in mitochondrial density without a significant loss in functional capacity. This essentially means that we have many fewer mitochondrial workers that are able to perform the same amount of work. So future studies on protein and genetic markers of selective mitophagy will hopefully provide some new targets for our studies and for medical and surgical treatment of obesity. I'd just like to thank my research mentors, Dr. Phil Schauer and Dr. Vance Alba and Dr. John Kerwin's lab and SAGES and you guys for having me here today. Thank you very much.
Thank you so much. Are there any questions from the floor?